She was compassionate, knowledgeable, and you would truly feel she cared not only for my nephew, but for my entire family. You remember this person? My nephew, only 27 years old, passed away on 4/14 shortly after going into septic shock and DIC related to IV drug use. He was given multiple drug transfusions on 3 different pressors and given many other things to sustain him. He was an extremely difficult day, as you can imagine. Jen took him under her nursing care between 7 and 5. She was compassionate, communicated with the family in such a difficult time with such respect and compassion. We had up to 6 family members at a time in the room, and Jen didn't blink an eye and allowed us to stay together. Her assessment skills were on point and detailed. I know in my heart, as a nurse, with the care my nephew Michael received, he was not the only patient that receives that kind of nursing care. That is something within a person, and the nurse I know, Nurse Jen, treats all her patients in that same way. And for that, she should be recognized for the amazing, kind-hearted care, or kind-hearted nurse she is. I am nominating her for the Daisy Award because I have never felt in my heart so much gratitude for a nurse. For myself, also. She went above and beyond, and I know she has touched more lives in the same way. Even though my nephew is gone and at peace, my family and I can at least find some comfort knowing he was in excellent nursing and medical care in his last few hours, and everything that could have been done was done. Thank you for taking the time.
Thank you.
Congratulations. As you heard, obviously, from the nomination, did you remember the patient?
Absolutely.
What did you did you? I guess my question is, did you understand the impact you were having at the time with that family? Do you think, or were you surprised that they would take all that time to write all those nice things they said about you?
I was a little surprised that they went that far into it, but they were very grateful the entire time, and I knew that they saw what I was doing the whole time, and they did acknowledge that a lot, but I didn't know that it was going to get to this.
I think, when I read it, I think one of the things that struck me was that, a family at a time when they obviously sustained such a tremendous loss, their loved one who was quite young passed away, that they would actually take the time to really sit down and write all those nice things about you. That was
interesting that they I felt like they did that in the middle of their grieving period, and maybe that was what helped them. I don't.
Or maybe they were just that impacted by what you did. That was sort of how I read it.
Yeah.
How long have you been with us here?
I have been here 5 years. My first week here was the first week this ER opened. I came with the new ER.
So when we cut the ribbon,
yep,
you were here.
I was here.
And what is it that makes this job so meaningful for you? Because obviously you have such an impact on the patients you care for. Hopefully you feel that personally as well.
I do. I think it's so meaningful because we see such a diverse amount of reasons why people come here, and I feel like the sicker they are, the more you're acknowledged that you are meant to be here to help them and not, I don't know. I just feel like they acknowledge you when you work really hard, and they can see that you're there to help them.
What do you think it is you do that makes them see that? Because clearly I think what you're not either acknowledging or seeing yourself is that clearly something about the care you provide hits home for people, and they realize it. I don't think that always happens.
Right. I agree. I see that. I see where I differ is because I sit down level to level with everybody, and I talk to them as if it was my family, and I explain everything, and I keep them updated as I can, but I don't pretend that I am on the level of higher with my knowledge or anything. I talk to them as if they were, as if they were part of my own family.
What makes you think that's important? Like, why is that important for you to do that?
Because I think that that's what matters. I've had family members in the hospitals before, and I feel like when they walk in and it's just, this is my task to do, people just get so robotic with what they do that they forget that people are actually needing them to explain what's happening and not feel so lost in the process of what's happening.
And you have the power to put them at ease and lessen their anxiety at a time when you know, like this family.
Yeah, I
It's
think
probably
you
one of
just
the worst
need to-
days of their lives.
I think you need to just relate to people a little more as people than as you're their nurse and they're the patient.
Hopefully we do that.
Thank
Well,
you.
thank you. Thank you
Thank
for
you.
everything you do. We're proud of you.
Thank you
It's
so
so well
much.
deserved.